ER treats patients on first come first serve basis. Is that true?
We don't serve as first come first basis because we do a triaging system.
So there's also another online myth. If the patient is conscious, it's not serious. As an emergency consultant, what is your take on this?
So all conscious patient or not, it's not like they are not sick.
What happens when you immediately do a CT scan or an MRI? Like you said, you get a further clarity into what exactly the problem is?
Yes.
Hello and welcome to the News Minute. This is Real Talk powered by Apollo Hospitals Chennai. Joining me today is Dr. Dhevayani Rajan, emergency consultant. Ma'am, thank you so much for talking to us. What are the most common emergency cases that you see today, and how has this changed over the years?
So most common cases in emergency is that would be younger cardiac patients. So cardiac patient in the sense young patients who come in with heart attack. Okay, earlier days we used to say 60 plus or 70 plus would come in with heart attack, but now early 20s do come with heart attacks, and the cause would be early detection of any hypertension or diabetes would not be there in them, and they would ignore their symptoms and they would present late to us.
So which are the cases that, in the beginning, in the first instant, it looks minor and then it turns into a life-threatening case if not handled properly?
Yeah, again, so if any patient who's coming with chest pain, so if at all we ignore it to some like gastritis, so they just say it's gastritis, I have taken these medicines, and we would try and treat them, but in a moment it would turn drastically in a other way where we won't be having any time to deal with it. So heart attack, again, it will not have any time to deal with.
So what are the symptoms like people coming into the emergency care?
So people would come with direct chest pain, or they would come in with breathing difficulty, or they would come in with giddiness, vomiting, or back pain, jaw pain, or any pain which is radiating to their left arm.
So what are some of the rare and unusual emergency cases that you have dealt personally, and that people wouldn't expect that this would be an ER case?
Okay, again, so any case which would present like with simple dizziness, so we would be thinking it's a simple dizziness, but that would turn out to be a stroke. So these are unusual symptoms where people would ignore their symptoms thinking it could be a very minor thing, but that would turn out to be a stroke.
So what are the mistakes that patients or attenders make before reaching ER?
So when the patient is unconscious, never try to feed them. So if they are with low glucose, people try to feed them orally. So that itself can cause harm because whatever you're trying to feed can go into their lung. Okay, that can cause an adverse effect. So never try to feed anybody who is unconscious.
But have you seen instances where there are home remedies that are done before bringing a patient to emergency?
Yeah, for burns, they try to apply whatever the household things on top of the burns. So that and all we have to try and avoid, like applying oil or applying a coffee powder or toothpaste. That and all you have to try and avoid.
So how difficult is this Google diagnosis has become for doctors particularly?
Google diagnosis, again, it's going to be tough in managing those attenders to explain what we are going to do because they will have some idea on what is going on, and when we try and explain, that's going to be a bit of conflict. So again, that will not be really of helpful.
So have you seen cases of self-medication or misinformation that has worsened the patient's condition?
Yeah, they try and take the remedies, self-medicate, and then that would mask whatever the symptoms are, and they try and ignore and stay at home. They would say that our symptoms are getting better with the self-medication, and they would delay the treatment, and which can cause adverse effects.
And can you share some examples that you have dealt with or your colleagues?
Patients presenting with abdominal pain, we would have thought it would be a gastritis, but again, that would be a major vessel leak in the abdomen, which would turn out drastically into another way of management.
So how do you describe this misconception that, you can wait it out, like take rest for some time, everything will be okay, all these kind of ignoring the symptoms, like how does it impact the emergency cases?
Yes, being a doctor, I wouldn't advise people to wait on their symptoms, because earlier you detect, there are treatments different, and you can reverse whatever the damage which has happened. So I wouldn't advise to wait on their symptoms, even though their symptoms are temporarily getting resolved. I think they should seek medical attention to see what it is.
So if a patient is being rushed to ER, what are the most important things that they should keep in mind? Do's and don'ts.
Rush into the ER. We do need a attender who has been with the patient to know the history. If at all the patient can give a history, that's not a problem. But if the patient is not conscious enough to give a history, we need an attender who can give the history and who can provide the medical background of the patient, and who can take decisions on behalf of the patient if the patient is not conscious.
And what are the things that they should avoid?
Again, trying to feed an unconscious patient and using home remedies where they shouldn't be using it, and trying to ignore symptoms and sit back at home.
So from your perspective, from your point of view, what defines an efficient emergency response?
So it all starts with the ambulance. Yeah. So emergency response, in the sense, if people need help, medical help, they should rush to the emergency as early as possible. And that would be possible if they are coming through an ambulance. If they need help, they can call out for an ambulance. Why I'm saying ambulance is the emergency treatment can start right at the ambulance itself, so that we can try and avoid so many things and so many secondary damage which can happen. So the treatment can start at the outset.
And the concept of golden hour, is there enough awareness regarding that?
Yes, we are making awareness about the golden hour. So golden hour is being in various diagnoses as well. So golden hour is in trauma, golden hour is in acute heart attack, in stroke, and even in sepsis. So when the patient is having a severe infection, we do have golden hour. So all this can be managed right at the outset if they are calling out for an ambulance.
But in India, the first thing that they do is, if there is an emergency, they first visit the local pharmacy or the clinic, and they do self-medication. How does these procedures that they do affect the outcomes?
Yeah, again, speaking about India, economical thing. I wouldn't advise everybody can go to a tertiary care hospital. But with the symptoms, they should approach a hospital where they can provide treatment for such symptoms. Instead of going to a local hospital, again, they will be driven out to another tertiary hospital again. So they have to be moving on and on. But then when they are reaching at the tertiary hospital, the time window would have been crossed, and the doctors wouldn't be able to provide the treatment when they are at that point of time.
So how do overcrowding and resources constraint in Indian emergency departments impact the outcomes, impact patients in general?
Overcrowding is, again, I'm asking. So I'm saying, right? So one patient, one attender who can make decisions should be there. So when they're overcrowding, again, the doctor has to go and explain each and every attender. So one attender will come and then they will say, I want it to be explained for this uncle. I want to explain it to the aunt. So that is, again, treatment delay. The doctor has to come out each and every time and then explain to everything. So overcrowding should be avoided in emergency care setting.
In many cases, the family members make medical decisions, but if you have to consult more than one person, or if there is a delay when the case is very critical, does this create some kind of confusion while handling emergencies?
Yes. So when I say that golden hour, so in taking decisions with a heart attack or stroke, the time critical, it's all time critical. So when they pass on the decision making authority, so that is again going to delay. So one appropriate person who can give the decision would be better.
So I'll move on to the next portion of it, like the next focus, that the special focus. And also, ma'am, how does a well-equipped ambulance change a patient's outcome when he's being rushed into emergency? So what is the difference between transporting a patient in a basic transport vehicle or, in two-wheelers, or in any other mode of transport. Like, how important is the role of an ambulance?
There is definitely difference between transferring a patient in a public transport or in an ambulance. So because why I say is the treatment would start right away once the paramedic picks up the patient. So, and again, choosing the ambulance is really, really important. It's not just a ambulance with just an oxygen cylinder. Well equipped ambulance would have an oxygen supply, a ECG monitoring, a defibrillation, which would need if at all the patient has a cardiac arrest, and a well trained paramedic, and all the supportive medications whichever is needed in a life threatening situations. And the paramedic can contact the ER physician and they can coordinate and treat the patient en route to the hospital so that they can avoid the damages which has happened.
So, how important is this communication between the ambulance and the ER?
This communication between the ambulance, paramedic and the ER physician would be really, really helpful, because we would get a prior notification that such and such patient with so and so symptoms are going to arrive, and we would equip our ER ready to receive this patient. Say if at all a patient is presenting a symptom with stroke, so we would equip our ER with a CT scan table ready. We would inform the neurologist, we would inform the radiologist. So everything will be kept ready so that we can do the treatment within the golden hour without any delay.
Can you share some examples of what you just said now, the communication aspect of it? Like in your personal experience, like receiving patients who are very critical and there was information that was shared at the right time and things were like, readily available for the patient to treat them.
Okay, so patient would present stroke in the sense they would have a facial droopiness, they would have arm weakness or a speech disturbance or any trouble in walking or seeing, any symptoms or giddiness. So if at all they have such symptoms and they had called an ambulance, the ambulance paramedic would reach on time, and once they assess the patient, they would call the emergency physician and they would say, this, I have attended this patient with so and so symptoms, and they would make a vital signs of this patient. They will measure the blood pressure, they will measure the heart rate, and they will check the sugars. If at all the sugars are less, they would provide sugars and they would correct it. And then they would transfer the patient to the appropriate tertiary care center where the stroke patient can be managed. It's not any local hospital. They would transfer to a tertiary care hospital where the appropriate management can be done for this patient. So once they arrive, so the hospital, the ER will be prepared to receive this patient. So immediately the doctor would screen the patient with the symptoms and they would inform the neurologist and they would do a neuroimaging, that is with the CT scan. And if at all, if appropriate, they might have to do a MRI scan if at all required for that patient. So the scans would be done and it would be screened. If the patient has no contraindication for receiving a medication to reverse the damage which has happened, and then the appropriate medication would be provided.
And what are the common gaps that you see in ambulance services, and why choosing an ambulance before an emergency is really, really important? Choosing a proper ambulance.
Yes, choosing a proper ambulance is really important. Not just transport which can reach the hospital, that they can bypass the signal and then they can reach the hospital. Fully equipped ambulance is well and good because we can manage the patient en route to the hospital.
So this is another segment, ma'am, where I'll be asking you some common remedies or suggestions that is thrown by Dr. Google, and then your responses to it. So these are some online myths, ma'am, where people just Google and they'll figure out what needs to be done. So this is like, as an emergency consultant, there's this thing which is said on the internet that ER treats patients on first come first serve basis. Is that true?
So we don't serve as first come first basis because we do a triaging system. Okay, so we triage the patient once they arrive to the ER. So there are instances where a first patient would have come with a fever, but the next patient would have been wheeled in a trauma setting. Okay, so but we would give preference for the trauma setting. The people would think, I came first, why didn't they treat me? But because they wouldn't know the severity is so they would not be knowing it and they would be like fighting for, I came first, why didn't you treat me? So people should understand. So emergency treatment is given priority with the level of injuries or the severity, what shape the patient come in.
If symptoms go away, the emergency is over. You can go home. Is that true?
Yeah, so people do come with pain. Yeah, so once we give pain relief, the pain gets settled and they get better, and they usually wouldn't agree for further evaluation for the pain. So giving medication to subside the pain is not the solution. We need to understand why the pain has occurred. So people doesn't agree for that step. So they do come in the night with pain. Once we give pain relief, they just say, now I'm feeling better, I want to go. But the real thing is we need to understand why the pain has come. So we need further evaluation. So once a symptom gets better, the emergency is not yet over.
Okay, not yet over.
Yeah.
So once the symptoms are over, that's when the actual work begins.
So
of
yeah, we need to
investigating.
work up. Yeah, we need
Yeah.
to work up why the symptom has occurred.
Okay. So there is this saying on, there's this common myth that if someone is unwell, you should immediately give him food, water, and then take them to emergency.
That's the scenario which we all have observed. So if somebody is unwell, try and feed them forcefully through their mouth. So I wouldn't suggest that. As I told you earlier, that is going to cause even more worse and adverse effect.
Even more damage.
Yes, even more damage. Instead of helping them, you're going to worse the symptoms.
So driving to hospital is faster than calling an ambulance. As an emergency consultant, how do you respond to this online myth?
So again, as I told you earlier, calling an ambulance would be a better option because they can communicate to the doctors and the treatment would start right away.
All chest pain is heart attack, or it's nothing serious. Is that true?
All chest pains are not heart attack. But again, we have to do the evaluation to see it is not an heart attack. So do not ignore the symptoms because heart attack is not looking at the age these days. We have seen younger cardiac patients or a stroke patient. So do not ignore your symptoms.
Painkillers and home remedies can stabilize emergencies. We don't need emergency consultants. This is what online myth says. So as an emergency consultant, how do you respond to this?
So again, that's what. So they do take painkillers to subside their symptoms, but we have to understand what is the cause. So that is not at all the end. So that's the beginning.
So there's this one common complaint against the emergency department that you guys unnecessarily ask us to take CT scans because this is all unnecessary. How do you respond to this?
So according to the symptom, whatever is necessary, the test has been advised. So nothing is being advised unnecessarily. So things are done to rule out the major issues which can be treated or reversed. So we cannot ignore those symptoms. So we are advising for those tests like CT scan or an MRI because that can turn the other way.
What happens when you immediately do a CT scan or an MRI? Like you said, you get further clarity into what exactly the problem is?
Yes. So if at all the patient is presenting with the stroke symptoms, okay, if I do a CT scan, I can rule out if there is a bleeding in the brain or if there is a clot in the brain. If at all there is a clot in the brain, I can give medicine to reverse the clot and I can bring back the patient into his normal state. Okay, that should be done within the golden hour and he should fit in the criteria where I can give the medicine. So this I can do only if I do the scans. So if I ignore his symptoms and say, no, you will get better, you can go home, then his lifestyle is going to change again. Yeah, that which cannot be reversed.
So there's also another online myth. If the patient is conscious, it's not serious. As an emergency consultant, what is your take on this?
So all conscious patient or not, it's not like they are not sick. If you're unconscious, then you're even more sicker. Yeah. So treat when you're conscious. So you don't ignore your symptoms. Do come early.
Do come early. That's the word.
Do come early. Yes.
Thank you so much, ma'am, for joining us.
Thank you.